We're looking at a surge of not just Omicron cases, but also Delta cases. If we talk about Delhi, it has recorded more than 1,300 cases in a single day now, and the surge has been exponential with the rising positivity rate as well. To talk more about this, I have with me Dr. Dhiren Gupta, who is a pediatrician and pulmonologist, a senior consultant at Sir Gangaram Hospital. Doctor, thank you so much for joining me on India Today. I just want to understand from you, what is the situation for patients looking like who are getting infected with the Omicron? Because Delhi, just like Maharashtra, is also reporting a high surge of Omicron cases.
Yeah. First of all, one thing, one sentence I always start with: don't panic. Need not to panic. One thing. Second, because once we panic, we start working at spinal reflexes. So that is not good for our society. Let's know the reality and go ahead. So what is the reality? Reality is that what we are, fearing for past 1 month, that it is something like the lion is coming and coming. It has come, it has arrived at our doorstep, and now it has invaded. Means Omicron, or you can say COVID, has definitely invaded our society. It started from the West, South Africa. Now it's there. So past 1 week, I'm getting a lot of phone calls from the patients from for consultations. And but good point is that despite of lot of calls we are getting, none of the patient till now has required oxygen. Now,
Okay.
having said that, as you rightly, correctly pointed out, that we are facing COVID. We don't know whether it is Omicron or whether it is in a Delta wave. Now, again, to differentiate as a public is very difficult unless we do micro sequencing. But of course, what we know by our data, what is been provided by Delhi government, around 40 to 50% are Omicron, right?
Right.
Now, this is going to be difficult because we all know that Omicron is milder and Delta can be severe. But we need to watch for our symptom. We need to watch for the severe symptom in any given patient. That is the bottom line.
No, certainly. So, how many of these patients that you are currently consulting for have been infected by the Omicron mutant? And what is the age group of these people?
Now, you have asked me that how many of patients, what we are looking at, whether online or physically, are infected with Omicron, right? As a clinician or as a normal human being whose test is positive, presently it's not easy to determine what type of infection we are suffering from. Omicron is different from any other virus. That suppose today I've been exposed to virus, within 2 to 3 days I'll be getting symptom, as compared to Delta wave where it used to take around 5 6 days.
Right.
Now, other than those symptoms are not very much different. But as a clinician or a laboratory, it may be possible in near future. So I'll just tell you the technical part. A COVID positive means it is a COVID virus. A COVID virus can be Delta, can be non-Delta like Omicron. The
Right.
Omicron virus is little bit different. It has got S gene target failure, means the S gene which normal kit can detect in any COVID. We won't be able to detect S gene in a given in RT-PCR positive. Then we can say it is a COVID infection, but we are not
Right.
able to get an S gene. So likely it may be Omicron. So very near future, we are going to have dual PCR test that is will be available, I think, 2 weeks from now or 1 week from now. So in first test, we'll be able to detect it's the RT-PCR positive. In second PCR, S gene won't be able to detect. Then we can say Omicron. So it may carry some importance, but presently we don't know how this Omicron is going to behave in our society. We are not South Africa, we are not UK, we are not America. We have recently suffered 6 months back, 8 months back, suffered huge pandemic because of Delta plus. We have got antibodies. 90% of people do have antibodies, and almost 30, 40, 50% are double vaccinated. So presently we don't know how COVID is going to behave in the present circumstances. And presently also 40% is Delta as per the government data.
No, so these patients that you've been consulting, are they all double vaccinated? And because Delhi had shown a seroprevalence of at least 90%, where 90% population of Delhi had developed antibodies against COVID, but that may have been against the Delta variant. So are these people once again getting infected, and what is the reason for that, sir?
Yeah. It's too early to comment because yesterday I have around 12 patients, right? And there were total four families who suffered from this COVID, and three were kids around 11 and 12-year old, and two of the families, the kids got the infection and they brought the infection to the home, and
Okay.
one was, they were in Chandni Chowk and doing shopping, they got infection. So this was the source in all these cases, but they could not pinpoint who gave them the source. So rightly, it is a community transmission has started. One thing.
Hmm.
Second part, you have asked that out of these patients, how many of were vaccinated? As I told, as we know that kids are not going to be vaccinated, means because the vaccine is not available for 11-year-old. But
Right.
two of the kids of that family got vaccine in the US, and they too are also were positive. They got
Okay.
they got Pfizer one, and they also got infection, and they were positive, but they were asymptomatic.
Hmm.
So till now, what I could conclude that, of course, booster dose and vaccination has helped us in preventing severe disease. May
Hmm.
not be infection per se.
Hmm. And they are all mild patients.
All are mild patient, and
Hmm.
none of
Hmm.
the patient presently, I can be sure that none of them are requiring hospitalization, and but most of them are having fever. And what I found the difference is that kids were having more high grade fever as compared to the adult population. Adults were relatively having mild disease as compared to pediatric age group. And again,
Right.
say just 4 or 5 patients of pediatric doesn't mean that it is going to be applicable to whole population.
Hmm. So there's been two studies that have been published recently. One from South Africa's Gauteng province, and that has been published in Lancet as well as JAMA. These studies, they say that there's no need for oxygen for patients who are getting admitted with Omicron, and it's also not requiring ventilation, and very few deaths are coming forward. But what does the data say if there's 3 to 15%
Yeah.
hospitalization due to Omicron? Am I right? What does the data
Yeah.
say
Yes.
in
Yes.
terms of
Yes.
the
Yes.
Indian population?
Yeah. Their data is based on the type of population, which age group it belongs, like 22 for 30 years, 30 to 40 years, 40 to 60 year, and 60 year plus, and how much they were vaccinated. Around 40 to 50% were vaccinated, means less than 40% were completely vaccinated. So,
Right.
and they didn't suffer the major problem with the Delta plus wave in say 6 months back, and something that happened in India. So
Hmm.
our population is entirely different. So our
Hmm.
circumstances is entirely different. But as a
Right.
general public, what we cannot be complacent. We should think that it is something like a share aya, and whether it comes out to be nothing at all, and no severe COVID cases. But we
Hmm.
should be wary about it. We should be ready about it. And presently looks like one booster injection at an
Hmm.
appropriate time, and second
Hmm.
is COVID appropriate behavior, which looks very difficult for many people. But
Hmm.
another 4 weeks are going to be testing time for the whole population.
Hmm. So, what is the prediction of cases for the Indian population if that is the scenario here?
I'm not epidemiologist, but there was a very good article by Trupti, and she's an infectious ID disease expert in Mumbai. And
Hmm.
what I could quote, she also quoted as per the rise in COVID infection in the West, she quoted that around 26th of January, there may be lakhs of cases, maybe 4 or 5 lakhs per day.
Hmm.
And we know that it cannot be false, or it cannot be just taken less lightly, because we have seen in past also it's always into 10 what happened in the West, and the severity is always more in India because of huge population. Means say cities in the west have got say that population where we have got the same population in very small area. We all know this, right? So one should again not panic, but little bit scare should be there about whether it's a mild infection, whether it is going to be moderate infection, and the prevention is going to be cure for our population.
So right now, the government has decided that they will vaccinate children between 15 to 18 years of age. You yourself are looking at patients where children are below the age of 15. And other countries like the US, UK, they have open vaccinations for children till the age of 5. How long do you think India should wait before doing the same? Because children below the age of 15 are also getting infected with COVID-19.
Yeah, we all know that pediatric age group themselves doesn't suffer from severe infection, but they can get infection from the community and transfer to the elderly population in any given community. For a hard community, hard infection, hard, you can say vaccination or protection, we need to that everybody in the family, at least 80-90% of the members should be immunized for some infection. And secondly, more severe the infection in even in pediatric population, they can spread more as compared to milder one. Even if you are able to reduce the severity of infection in pediatric population by vaccinating them, it's not a bad idea to protect the whole. Means it can be protective factor for the whole community, especially for that home. Now, we can, we have got limited resources. We know that there are going to be vaccine hesitancy, and when actually vaccination comes to pediatric population. So what we can subdivide the population, pediatric population. Say we have started vaccinating between 15 to 18. Now very soon we should open up vaccination between 11 to 15, followed by 5-year plus. And first of all, we should target the pediatric population with comorbidity, like who are diabetic, who are hypertensive, who are obese, and who are immunocompromised. We should target them first. Then we should go to the younger population. And recently, we have got Covaxin trial, which has been published phase 2, phase 3. They divided into 3 groups, that is 2 to 6, 6 to 12, and 12-year plus. And they found it is quite immunogenic, quite safe vaccine. So we have got good vaccine. We have got quite safe vaccine. And it is just, when government allows, we should start vaccinating them.
Well, Dr. Dhiren has given out a very clear message that people are getting infected in Delhi. There's no need to panic, but even double vaccinated people and cured from previous COVID are getting infected. So it's very important to wear a mask and stay indoors, avoid crowds and gatherings, and continue to mask yourself and take your vaccines on time, because Delhi is currently witnessing a huge surge in COVID cases as well as the Omicron cases. Thank you, sir. Thank you for speaking with us.